Hi Zainab, thank you very much for agreeing to do this with me today. So the purpose of my interview with you is to better understand, and the aim of it is to better understand my communication skills and how to effectively use it in a health profession situation. So you being a nurse, could you talk a little bit about what you do and what field you work in, if that's okay, and how communication skills is very vital in the workplace?
I work as a nurse in an emergency department at a major public hospital. I am a very new nurse. I've been a graduate for 6 months now, and communication is very important for me to get, especially as a new graduate, and in a new setting. Communication is important so that I know how to do my job, to ask important questions when I don't know when I need help. Yeah, communication is important so I don't even harm my patients. So it's just this: if you don't communicate, you're wrong. Like, the first thing that we were taught is ask questions, make sure you communicate, express yourself clearly, so then others know what you're thinking. And yeah,
so in saying that, you just said that if you don't communicate, it's wrong and it can, not be good. What happens and what consequences might arise from a lack of poor communication skills?
The one thing that can arise is there will be harm to the patient, whether it's directly or indirectly. If I don't ask questions when I don't know how to use an equipment, for example, or I do not know how the plan or how this certain ward runs, or how they expect us to document something, then I'll do it incorrectly, and that will inadvertently or inconsequently harm the patient. If I don't communicate with the doctors properly, if I don't communicate with the physiotherapist. So at the end of the day, it's harm to the patient, and as a nurse, your job isn't to harm anyone, it's to not do harm. So yeah.
Exactly. So as a nurse, in your day-to-day life at work, just routinely, what type of communication skills do you use, whether it's with patients or staff or doctors?
We use verbal communication, written communication, and there's both informal and formal communication. Verbal is usually the informal communication, where you would communicate, for example, with a physiotherapist who sees you walking down from a patient from the toilet, and they're like, okay, and you just nod at the physiotherapist and say, this person's one assist.
Yeah.
And then a formal written is when at the end of the shift you have to write a documentation on online or on a progress note, where what has changed during that shift, what have you done for that patient. And the other formal communication, which is a verbal one, is at the end of each shift, or whenever you're giving that responsibility from yourself to another staff, another nurse, for example, you give a concise, up-to-date handover of this patient's situation, what's their background, their assessment, their plan.
Very interesting. So in the health profession, especially being a nurse in a major hospital, why do you think, and especially like you were saying, in an emergency department, which is probably hectic, why do you think communication skills is really important?
It's really important so that things run very smoothly. They run flow, and we can prevent harm from happening. We can detect when patients are about to deteriorate or getting sicker. We can communicate with the other staff members. This patient is getting sick, and we can intervene quickly. We can communicate so we don't cause harm. It's very important. I don't know how to say other than what I've said before, that to provide patient safety, and even safety for ourselves. Like, if you don't communicate properly, then you're lifting a patient up, you're going to hurt your back. If you're pushing someone, you don't communicate, you're going to hurt. If there's spill on the floor, you don't communicate that there's spill, and you don't put something else, you're going to hurt somebody else, you're going to hurt others. And especially in a hospital setting, there's violence, there's more alcohol and more drugs involved nowadays than there probably was in the past as well, but I mean, like, if you don't communicate, yeah.
So sometimes when I'm speaking, and one of the biggest things that I struggle with is speaking a little too fast, and sometimes not being able to project what I'm trying to say. So for you, being in a really big nursing hospital, do you ever come across yourself not being able to communicate well with colleagues and stuff, or do you ever struggle to say what you're thinking?
I know what you mean. I'm a graduate nurse, very new to this game. I get nervous, and when I get nervous, normally I speak fast. I'm very inexperienced as well, and because of that, I have communication barriers where I struggle to communicate what I'm thinking, what I'm saying in a very concise, intellectual way, I guess, or articulate myself properly. And I guess if I take a step back and I look at my surroundings, I can communicate better.
Okay, thank you so much, Zaina, for doing this with me. It actually meant a lot, and I'm excited to better my communication skills in the health profession.
Yeah, I think so, yeah. The one thing is...
That's it. Time's up. Time's up. Time.